Elaine and I both feel strongly that expanding our practice in this particular way lets us give far more comprehensive and integrated care to the people we see, and in that way improves the quality of outcomes. And I have seen it myself in the context of I live and work in an isolated rural community. It's 200 miles to specialty medical care in the big city. And so we have lots of problems out there, both with access of care and with care that gets fragmented. Many people who clearly need care only to get an initial appointment with one of our local psychiatrists can be 2 to 2.5 months. And in the meantime, lots can happen. People can deteriorate and end up in the hospital, which is tragic for them and very expensive. Some people try to treat themselves in non-prescription ways and end up in jail. And that also is very expensive to society and is an unnecessary tragedy for the person. Psychologists have extensive training in formalized assessment and interviewing and psychotherapy and behavior modification techniques. So when we think about pharmacology, we come from a mindset of, and what might the alternatives to prescription medications be? So in order, in part, to help her benefit better from the counseling as part of alcohol treatment, she and I agreed to taper her down gradually and see if her thought processes remained coherent and whether there was any recurrence at all of the hallucinations. So by the time she was discharged from residential alcohol treatment, she was on just over 1/10 of the dose of the antipsychotic that she had been taking when she came in. And the authority to prescribe is also the authority to take a very careful look at what's going on and, if necessary, unprescribe. Illinois has much the same problems as New Mexico in terms of access, geographic access, and access in the sense of what providers out there who are permitted to prescribe are willing to accept Medicare, Medicaid, some of that. We understand that has been a chronic problem here in Illinois. The other thing that I think is important is to think of quality of care, that you're getting not only your counseling but also your medication prescribing and monitoring from the same person who can see you more than once a month, and sometimes in New Mexico once every 3 months. If something happens to you within that 90 days, you may be out of luck unless you have quick access to get back in, and equally importantly, an ongoing personal relationship with that person who's prescribing, not just 15 minutes in and out of the office, bam, 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 which is tragically, how much of medical care goes these days.